Bismillahirrahmanirrahim. Assalamu alaikum. My name is Daniel Akhtar. I'm working as a lecturer in University of Lahore at the Department of Rehabilitation under the umbrella of Faculty of Applied Health Sciences. Today we're gonna discuss about the different disorders of ear. First of all, we discuss some terminologies, basic terminologies which causes hearing loss. Tinnitus is the ringing sound from the ear. इसमें लोगों को रिंगिंग साउंड आती है ईयर से. ओटेल्जिया विच कॉजेज ईयर पेन्स. बैरोट्रोमास इंजरीज कॉज बाय इंक्रीज्ड एयर और वाटर प्रेशर. मेरिंगोटोमी इncision of the eardrum. Otorrhea, purulent ear discharge. These are some common terminologies which adversely affects the ear. Meringoplasty, closure of perforation in the tympanic membrane. Tympanoplasty, surgical corrections of tympanic membrane or ear bone. Presbycusis, which is age-related hearing loss. Otosclerosis is the fixation of ossicles in the middle ear, which causes hearing loss. Endolymph is a fluid level which lies in the cochlea, membranous part of the cochlea. Disorders of external ear. Otitis externa is the most common pathology of the outer ear. It refers to the inflammation of the external auditory canal. There are some basic causes of otitis externa. First of all, the viral infection named as Staphylococcus aureus, which causes otitis externa and which causes boils in the formation, boils in the auditory canal. Swimmer's ear, water in the ear canal. Prolonged exposure to moisture or by allergic reactions to dandruff, soaps, sprays and hair dyes. There are some pictures of otitis externa. There is, we see in this picture that there is the formation of boils in the external auditory canal. Clinical manifestations shows pain and discharge from external auditory canal, fever, pruritus, hearing loss, or feeling of fullness. Impacted cerumen. It is a condition in which earwax accommodates the ear canal, leading to blockage and pressure on ear canal. Impacted cerumen. It is a condition in which earwax accommodates in ear canal, leading to blockage and pressure on the external auditory canal. There are some basic causes: use of hand-frees, hearing aids or earplugs, putting objects in the ear, anatomical defects. Older age is the basic cause of impacted cerumen. There are some basic signs and symptoms which patient shows like tinnitus, itching, difficulty in hearing, ear discharge, odor coming from the ear. Third one is otitis funclosis. It is infectious disorder characterized by formation of boils in the hair follicles of the external auditory canal. Poor hygiene, malnutrition, weak immune system, presence of scratches and wounds are the basic causes of funclosis. This picture shows the formation of boil in the external auditory canal, which causes hearing loss. Sign and symptoms. Tenderness and hearing loss are the basic signs and symptoms of funclosis. Disorders of middle ear. Otitis media. It is the inflammation of mucous membrane of the middle ear, eustachian tube and mastoid process. Acute otitis media is the type of otitis media in which the inflammation of the middle ear occurs and it lasts for less than 6 weeks. This is the picture of tympanic membrane, and behind the tympanic membrane there is the fluid which we call as otitis media. There are some causes of otitis media: entry of pathogenic bacteria into the middle ear, infection of upper respiratory tract infection, and perforation of the tympanic membrane. Sign and symptoms: acute onset of otalgia, patient feel fever as well, sleeplessness, irritability, pulling of the ear by the child. Serious otitis media. This is also known as glue ear or secretory otitis media. It is the collection of fluid without evidence of active infection in the middle ear effusion. It is commonly found in children. Causes: auditory tube obstruction, we also called as eustachian tube dysfunction, pharyngeal swelling, and enlarged adenoids and tumors also cause otitis media. Barotraumas due to sudden pressure changes in the middle ear, as in aeroplane descent when suffering from cold. Obstruction of eustachian tube due to nasopharyngeal carcinoma. Radiation therapy or untreated acute otitis media causes acute otitis media. These are the leading causes of acute otitis media. Clinical manifestation of acute otitis media shows hearing loss, sensation of congestion, dull tympanic membrane appearance on the otoscope. Air bubbles may be seen in the middle ear. This picture shows the dull tympanic membrane, which refers as the that there is the formation of acute otitis media behind the tympanic membrane or in the middle ear. A chronic otitis media. It is a chronic inflammation of the middle ear with tissue damage, usually caused by repeated episodes of acute otitis media. Recurrent, persistent, and untreated episodes of acute otitis media, mechanical injuries, mastoiditis, long-standing inflammation in mastoid, poor hygiene, and measles are the basic causes of chronic otitis media. Clinical manifestations of chronic otitis media shows persistent blockage or fullness of ear, foul smelling, ear drainage, hearing loss, fever, tenderness of mastoid, as well as redness, edema, and swelling of the middle ear mucosa. This picture shows the devastating effect of chronic otitis media in the tympanic membrane, as well as there is the abnormal formation of the cholesteatoma in the middle ear. Disorders of inner ear. Hearing loss, may also known as hearing impairment, is the partial and total inability to hear. It may occur in one or both ears. There are some different types of hearing impairment. First one is conductive hearing loss. It usually results from an external ear disorders such as impacted cerumen, middle ear disorders, otitis media, and otosclerosis. In such conditions, the efficient transmission of sound by air to inner ear is interrupted. Another type is known as sensorineural hearing loss, in which the root cause lies in the inner ear or sensory organ, cochlea, and associated structures, vestibulocochlear nerve dysfunction as well. This is the most common type of permanent hearing loss. The third type is known as mixed hearing loss. Both conductive and sensorineural is present, resulting from dysfunction of air and bone conduction. So in this picture, if there is any anomaly in the conductive root of the ear, which causes conductive hearing loss. On the other side, if there is any anomaly or pathology in the cochlea or the vestibule or the vestibulocochlear nerve, then we called as the sensorineural hearing loss. Causes of conductive and sensorineural hearing loss. Impacted earwax or foreign body is the cause of conductive deafness. Acute, serious, and chronic otitis media may also cause conductive hearing loss. Otosclerosis may also cause conductive hearing loss. Injury of the tympanic membrane may also cause conductive hearing loss. Presbycusis may cause sensorineural hearing loss. Congenital conditions may also cause mixed hearing loss. Meniere disease may also cause sensorineural hearing loss. Any type of infection like mumps, herpes zoster, meningitis, syphilis, also called mixed type of hearing loss or sensorineural as well. Clinical manifestations: tinnitus and increased inability to hear. Students with hearing impairment will be inattentive and uninterested in class. Speech deterioration. Meniere's disease: it is a disorder that affects the inner ear. It causes vertigo, sensation of spinning, hearing problems, or a ringing sound in the ear. It usually affects only by one ear. Causes are excessive production of endolymph, viral infections, allergies, medications like aspirin, stress. Clinical manifestation: vertigo and dizziness, tinnitus and hearing loss or deafness, fullness in both ears, photophobia, nausea and vomiting. These are the common clinical manifestations of the Meniere's disease. Labyrinthitis is another inner ear disorder. It occurs when a vestibular nerve becomes inflamed. Causes are acute otitis media and meningitis, viral infections, head injury, and neoplasm of the middle ear or the eighth cranial nerve, alcoholism, allergy. Upper respiratory tract infections are the common causes of labyrinthitis. This picture shows the viral effect of labyrinthitis on the eighth nerve, and the viral infections are influenza virus and herpes simplex virus 1. Clinical manifestation of labyrinthitis are extreme vertigo and dizziness, sensorineural hearing loss, tinnitus, otorrhea, otalgia, neck pain, stiffness, cognitive impairment like memory and thinking problems. So the summary of the whole lecture is: disorder of outer ear, otitis externa, impacted cerumen and furunculosis are the major disorders of outer ear, as well as disorders of middle ear. Acute otitis media, serious otitis media, and chronic otitis media are the common pathologies of the middle ear. And last one is the disorder of inner ear, hearing loss, which also have different types of hearing loss. Meniere disease and labyrinthitis are the common pathologies of the inner ear. Thank you so much.